Back now on Triad Today, it's my pleasure to introduce you to a very special guest, J. Power Director, if we can meet, to the very distinguished Dr. Adam McDermott. He is with Cornerstone Behavioral Medicine, and Dr. McDermott is going to talk to us about memory loss. Welcome, Doc. How you doing?
Very good. Thanks for having me.
Good to see you. You look too young to be a doctor. How old are you, like 13?
Just about.
You're in your, what, 30s now?
Right.
That's right. Okay. Now, where were you born?
Around Pittsburgh.
Really? So you're a Steelers fan?
You have to be.
You have to be. That's right. Let's talk about memory loss. Now, does everybody experience some kind of memory loss?
Well, it's a good question. I mean, as we all get older, we tend to experience certain age-related declines that are expected. And while memory impairment isn't particularly one of them in the sense of impairment, we all have little slips, I think, as we get older. You walk into a room and you go,
where is this?
Yeah, what did I come in here for?
But how do we know, that's happened to me, but how do you know if it's serious or if it's just a fluke?
Well, what I always advise to people is that any time where either the frequency or duration of something like that is becoming concerning to you, then at the earliest possible for you to go ahead and get checked out, because obviously if this is something that could be progressive and not age-related, we'd want to catch it as soon as possible. So,
all right, now you've said a couple things. You got to slow down a second, because I mean you're way ahead of me. I'm trying to get my brain wrapped around this. Now, some of it's due to aging, and some of it's due to other things like neurological things, whatever. I mean, help me out. What's the first step in trying to diagnose that you have a problem in any way?
Well, the first step is like I said, to get checked out anytime you have a concern. So you may go to your primary care physician and report your symptoms to them, and they could refer you to some kind of specialist like a neurologist.
Okay, I got you. Now,
Yeah.
How do we, once you say, well, look, you do have a problem with this, how is it treated?
Well, it depends on really what types of problems you're having and what could be causing them. So you might go to a neurologist and then get referred to someone like myself, like a neuropsychologist. And what I do is functionally measure people's thinking skills. And a neurologist can help to look at MRI scans to see if there's any kind of neuroanatomical changes.
Because there might not be any physical thing wrong with you, but then you still need to help me. Now, now how do you help somebody in your practice?
Right. So like I said, I functionally measure people's thinking skills via paper and pencil type tasks, and really to help in conjunction with, say, people like neurologists to see, compared to a particular person's cohort or their age and education, where do they perform? What are they doing very well? Where are they performing where we expect them to? And are they having any impairments or reductions? And if so, what might that mean?
It's almost like it's studying it from an occupational standpoint, isn't it? Sort of to determine what that person needs to be doing, where they should be. And,
exactly.
That's interesting. Are there any new medicines or treatments on the horizon that might cure or delay memory loss as we get older?
That's a good question. I really hope that there will be. That is a good question, more under the purview for a neurologist to answer, but we know of medications that help slow the progression in some people who we know have like a disease like Alzheimer's. It's not a cure. Sometimes it can enhance someone's thinking skills for a while, but in general, from my understanding, all we have right now are medications to help slow down the progression of these of the disease.
And we only have about a minute left, and we could take 30 minutes on this, but I'm trying to think of the difference between, if you have some memory loss problems, it doesn't necessarily develop into dementia. So, I mean, what's the difference? Can you give me like 20 seconds on that?
Sure, like the difference between someone who just has mild difficulties. Well, that's exactly what it is. It's all about determining what difficulties, if any, you're having, and then tracking the trajectory of that to see, because sometimes people can have a variety of reasons to have memory loss, and it's either age-related or it might be very mild, or it could be something that down the road develops into something like a dementia. So we want to keep track of that to make sure that we're giving them the best treatment possible.
I want to ask you about where your office is located, but first we're looking at on screen the website, the general website, cornerstonehealth.com, which has just gobs and gobs of great information for you on all sorts of topics, including this one. But where's your office located?
We're out of the Westchester building on 1814 Westchester Drive, out in Suite 402. So
in High Point. All right, good. Dr. Adam McDermott, thanks. Will you come back sometime?
Absolutely.
Thank you, sir.
Thank you for having me.
We'll be right back.